Hello everyone, this is the second topic in the 5 marker, that is herpes zoster, and we are going to discuss this as a 5 marker herpes zoster. And let's see what this has been asked in the university exam. So let's see what and all you can write in the herpes zoster. Let us start with herpes zoster. Herpes zoster is an acute infectious viral. Okay, so it is a acute kind of a viral infection. So it is a disease of an extremely painful and incapacitating nature. Okay, so it is extremely painful. First is it is acute viral. Second is it is extremely painful. So these two things you have to write in the definition. So herpes is an acute infection and it is extremely painful and characterized by inflammation of the dorsal root ganglia. So what is getting affected here is the dorsal root of ganglia. Okay, in your James Ramsay Hunt syndrome was this ganglion. I'll show you this geniculate ganglion, and here it is the dorsal root of the ganglion. Okay, then coming to the predisposing factors, what could be the predisposing or risk factors? First is immunosuppression, HIV infection, treatment. So now the cause is the virus. The risk factors could be the immune suppression, HIV infection, treatment with immunosuppressive drugs, radiation, presence of malignancies, Hodgkin's lymphoma, malignant lymphomas, old age, alcohol abuse, stress, and dental manipulation. So that is why we are going to read it in detail, because it has something related to us. So dental manipulation is also an important predisposing factor. Okay, dental manipulation as in the trauma occurring if you while doing a surgery, or simple traumas could also be a predisposing factor. Coming to the etiopathogenesis, Varicella-Zoster virus. So Varicella-Zoster virus, VZV, is the virus that enters the DNA, causes an initial infection. So how it enters the human DNA, this pathogenesis is already very similar pathogenesis to the HSV. It like how HSV enters the human cell, same way the viral DNA also enters in varicella zoster. So it is an initial infection is chickenpox. So first varicella zoster virus infiltrates the human cell and initially shows a clinical manifestation of chickenpox. Then the virus is transported to sensory nerves and establishes a latency in the dorsal spine ganglia. So after showing chickenpox as the clinical manifestation, the virus goes to the sensory nerves and becomes latent there, okay, in the dorsal spinal ganglia. Then reactivation of the virus occurs, and with involvement of distribution of affected sensory nerve, resulting in herpes zoster. So basically herpes zoster is not a virus. Varicella-Zoster virus is causing herpes zoster. The latent or the secondary stage, once it goes latent and then it reoccurs as herpes zoster. Okay, so the recurrence factors could be varying factors as the predisposing factors. Okay, then coming to the clinical features. Now what are the clinical features? Age is it occurs to 2nd to 8th decade of life, and gender is equal gender distribution. Clinical features are grouped as prodrome, acute, and chronic. Chronic includes your Ramsay Hunt syndrome, and let's see what is prodrome and acute. During initial viral replication, active ganglionitis develops, resulting in neuronal necrosis. So this is basically a disease of the nerves. So all the damage that will be happening will happen to the nerves. So nerval necrosis occurs and overall severe neuralgia occurs. This inflammatory reaction is responsible for prodromal symptoms. Okay, then prodromal phase. In this there is intense pain, that this is the initial phase. Okay, there is intense pain that precedes with a rash in more than 90% of the cases. So in the initial phase there is a rash that develops, then the virus travels down the nerve, the pain intensifies. So the virus enters the nerve, then there is pain, intense pain, then the virus goes deep towards the nerve down and the pain intensifies. The pain is like a burning sensation, tingling, itching, and prickly or knife like. Okay, so just imagine how horrible the pain could be: burning, tingling, itching, prickle, or knife like. Then the pain develops in an area of epithelium which is innervated by affected sensory nerves, dermatome. So what does this mean? There is pain in the epithelium, so basically area of epithelium, and it is innervated by sensory nerve. So the dermatome layer of the skin or the epithelium which has a sensory supply, the pain is transmitted there. Then there is thoracic dermatomes affecting 2/3 of the cases. Pain is accompanied by fever, malaise, and headache. 1 to 4 days before the development of cutaneous mucocutaneous lesions. So there is pain. So after pain there is fever and headache. Malaise and fever and headache. After 1 to 4 weeks, there is fever followed by pain and headache. After these clinical symptoms, 4 days after these symptoms, there is a development of mucosal lesion. Okay, this mucosal lesion presents as a sensitive teeth. So this no, so there is a mucosal lesion after 4 days. After that, now we are going to describe the pain. Okay, so the pain is present as sensitive teeth. So what all the pain could be? First is the sensitive teeth, then otitis media, migraines, myocardial infarctions, appendicitis, depending on which dermatome is affected. So basically which layer is affected, the clinical manifestations change. 10% of affected individuals have no pain. Occasionally there might be recurrence in absence of vesiculation. Okay, zoster sign herpete without a rash. So asymptomatic zoster is called zoster sign herpete. Okay, then there is acute phase. In acute phase there is first phase was your primary phase or your prodrome phase. Now your second phase is your acute phase. This acute phase involves skin, develops clusters of vesicles in the skin, sets an erythematous base in the skin. Then so basically the skin becomes red. Then a few drops of a dewdrop so basically when it affects the skin, there is vesicles and there is erythema in the skin. The appearance of the skin is dewdrop on a rose petal. Okay, so when there is dewdrops on a rose petal, how it appears, the same way the erythema with the vesicles appears. Okay, then within 3 to 4 days the vesicles become pustular and ulcerated. So the vesicles fill with pus and ulceration occurs. Then there is crust which is developed over the erythema in 7 to 10 days. Then the lesion follows the patch of affected nerve. So the lesion is following a patch, then wherever the nerve is affected, it is terminated at the midline. Then there is exanthema resolves in, so basically the rash resolves on its own and it heals by scarring. And hyperpigmentation could be the cause of the scar. Then the scar could be the cause of hyperpigmentation or hyperpigmentation. Coming to the oral manifestations, this is what we need to know. Oral manifestations are in relevance with the trigeminal nerve. So our topic of interest is trigeminal nerve, which may be present on movable or bound to the mucosa. Okay, so the location is movable, bound to the mucosa. So basically we're talking about the lesion which is involving the trigeminal nerve. The lesion could be movable or it could be bound to the mucosa. The lesion extends to the midline and it presents at a conjunction with the involvement of skin. So location could be, it could be present on a movable or bound mucosa. The lesions extend to the midline, present in conjunction with involvement of skin overlying the affected quadrant. So there is an involvement of skin. Okay, where, so basically what you need to know is there is a lesion which is involving your trigeminal nerve. This lesion could be fixed or movable. Okay, then what you need to know is it occurs on skin because there is an involvement of skin. Okay, that's all. Now after this lesion is white, opaque vesicles develop in the lesion. Then these vesicles rupture to form ulcers. Then there is involvement of maxilla, then devitalization of teeth. Okay, so there is involvement of maxilla, then there is devitalization of the teeth. In the involved the affected quadrant, you lose the vitalization of the teeth. Bone necrosis can also be seen with loss of teeth. And then there is close anatomic relationship between blood vessels and nerves. Inflammatory processes within the nerves have the potential to extend to adjacent vessels. Gnathic osteonecrosis is the secondary damage to the blood vessels. Then you have your third one, that is your chronic phase, that is occurring in as a syndrome. Okay, so there is a chronic phase in this syndrome. So basically this syndrome occurs in the geniculate ganglion and it has a chronic phase as well. So acute phase and a chronic phase of this syndrome. So the chronic phase is the continuation of the acute phase of the herpes zoster. Okay, so let's see what the chronic phase has. So just remember that there is a syndrome that I have already discussed. Now you have to connect the dots as we discussed prodromal phase. This is the acute phase and now we're discussing the chronic phase. So in acute phase you saw that there was a dewdrop appearance on rose petal. Then in oral the trigeminal nerve was affected and then there was trigeminal lesions involving the trigeminal nerve which were shallow. And then we move to the chronic phase where there is post-herpetic neuralgia. That is when the herpes zoster is continuing for more than 3 months. There is something called as post-herpetic neuralgia and the symptoms are burning sensation, throbbing, aching, itching and stabbing sensation. Often flares also develop. Then you do not have to mention the histopathology. The histopathology is very similar to HIV, HSV, acantholysis and Zank cells and nuclear beading. Then diagnosis is made with clinical presentations and culture. Then treatment is antiviral drugs, cyclovir, NSAIDs and corticosteroids. That's about herpes zoster. Thank you for watching. Subscribe to my channel.